what am I going to look like after my labiaplasty? And we're going to kind of take you through the timeline of what things look like right after, and then when you can expect final results. Hi everyone, welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by 2 board-certified plastic surgeons. I am Dr. Ashley Amalfi in Rochester, New York at the Quatella Center, and I am joined by my dear friend, Dr. Smita in Jersey. Hi, babe.
Hi, how are you?
I'm so good. Labiaplasty series is going so great. We're so glad to have you guys engaged and asking really fun questions. And you know, when we posed that we were going to do this topic, one of the questions we got a lot was, when and what do I expect this to look like I want it to look? So that's what we want to talk about today. What am I going to look like after my labiaplasty? And we're going to kind of take you through the timeline of what things look like right after, and then when you can expect final results.
Yeah, I mean, I think this is such an important thing to talk about, because I often tell my patients that the after is almost harder than the during, so the recovery
the procedure is easy.
Yeah, the procedure is easy. So, I think the hurdle of actually coming in to see us, I think a lot of people have a lot of nerves when it comes to that, obviously, because it's a sensitive area. So once you get through that, though, the procedure is easy, and then it's the after. So we want to make sure that you guys are so educated so nothing phases you. But yes. I think the biggest thing is just the amount of swelling that you're going to have afterwards, right, Ash?
Crazy. Yeah. I mean, I tell them it's going to look like 2 hamburger buns. It's going to puff up it gets so puffy. I mean, we're putting medicine in there, which makes it expand and gets puffy, but then it swells. Even if you're laying flat, it's just such a dependent area. It gets so swollen. So a lot of times what I'll do is I'll let them take a look at things with a mirror, and so that they can see what they look like. And I tell them to not mess with it too much, but it's good to know what it looks like so you can make sure it stays symmetric. And nothing bad is going on. But a lot of swelling is really normal, and it's going to look a little scary before it looks good.
Yeah. I mean, that's exactly what I tell them. I'm like, you're going to look and you're going to be completely freaked out, and it's normal. So
just trust us. Just trust us.
Trust us.
It gets better. It gets better quickly, but at first, I think that first week it's super swollen, and then it already starts to starts to come down at a week.
Yes. And I, in such a vascular area, and it's all mucosa, so it just really soaks up that edema fluid and swells up. To the point where I even tell patients, just don't really look, because I think also the tendency is you're like, what's going down there? And then you're trying to pull things apart to look and touching and kind of messing with it. And just the tension of pulling can sort of disrupt the sutures and all of that. So just expect it to, if you can think of in your mind, the worst swelling, and then it can sometimes be worse than that. So all normal, but like you said, it gets better quickly. But that's where, we talked about the last series, icing, elevation, all of that helps.
So helpful. And you mentioned not to pull on it because the stitches are really fragile, and I think that's kind of the next phase of things, because once the swelling starts to get better, the stitches are not yet healed, so that suture line is not really tight or strong, so you don't want to go rubbing it. And so that's why we really prolong any sort of activity, sexual activity or using tampons, because you don't want that tissue is not really sealed and very well healed, and so you don't want any tension on it. So that's why we'll usually wait almost 8 weeks, sometimes a little less, sometimes more, depending on how that's healing. So sometimes it's about 8 weeks, I would say, on average for sex and tampons. And so this is just something you need to know ahead of time so that you're kind of prepared for that.
Right. Yeah. I mean, the more you can protect those incisions, and even my runners, I tell them that they need to sort of,
it's irritating.
Just the friction of running early, getting back into that can cause issues. So, yeah, so we're not trying to be cruel. We just want to make sure that you heal well. And so we're super conservative about that kind of stuff where you're pulling on things. And
it's still not finally healed then, right? Like, even though like you're getting back to some normal activities, then you're working out, then you're adding in the sucks and tampons, it might still be swollen. And some people just hold on to swelling longer. And I have patients who sometimes have swelling just like any other surgery that we do for up to 3 to 6 months. And that can be totally normal. You just got to be patient, and, you know, we'll keep seeing you. And those tissues eventually shrink back down to normal. Like, they're not going to stay puffy or thick or swollen forever, but they may be puffy or thick or swollen for a while. But eventually that tissue goes down to be that nice thin tissue that it always was once it's healed. So that process is so different for everyone.
It's so different. And I think that's, you know, I always remind my patients, you know, so it's such a small area. So even if there's a millimeter of swelling, it's going to be noticeable, right? And so it's much different. Tiny anatomy. It's tiny anatomy, right? So it's similar to like a rhinoplasty, right? Where every millimeter makes a difference. Whereas if you're doing a tummy tuck and you still have swelling at 6 months, it's not quite that noticeable, and you almost are sort of at your completely normal results, your final results. But for labiaplasty, just tiny little things are so noticeable just because of the quality of that tissue that's there. But it's just such a small, delicate area. So just be patient with it. You're so
smart. Yeah. That's so good.
But just be patient with it, right? We'll be there every step of the way. So to reassure you guys.
You'll be able to look and kind of see where it's going and be excited about the results, because it is going to look better. It is going to be shorter. And you're going to it's going to make sense when you see it, but it's just not going to be perfect right away. You just got to be patient. It can be a long recovery. Some people bounce back really quick, but just like anything, you can have a lot of swelling, and we'll get you there. We'll help you get through the process. Make sure you heal really well.
Yes, absolutely. Goodness, awesome. I think is this like, does this conclude our series?
I think so. I think so. We're there.
Yes, guys, like, this was awesome. Such a great topic. And if you guys have any other topics you want us to talk about, make sure you let us know on our Instagrams or comments on YouTube. But we love doing this for you guys. We want you to stay educated and empowered and learn everything about plastic surgery from 2 board-certified plastic surgeons. So this was super fun.
All right. Take care, you guys. See you, Smita.
See ya. Bye.